This is Abia COVID-19 update.
Abia COVID-19 update.
No one is safe until everyone is safe. Let's begin this morning with the analysis of last week's figures. Nigeria's new COVID-19 infections increased last week despite a reduction in the number of tests carried out. Between Sunday and Saturday, that's September 20th and 26th, a total of 1,053 new cases were reported in the country, which is an 8% increase from the 968 recorded last week, 39th week of the pandemic in Nigeria. The increase, however, occurred despite a reduction in the number of tests carried out. A total of 30,354 samples were collected for testing last week, as against the 31,943 tested the previous week. That's a 5% reduction. The increase in the number of infections could be evidence of poor compliance with the safety protocols, which include but not limited to observation of social distancing rules and the use of face masks. And of course, meanwhile, the World Health Organization said 2 million COVID-19 fatalities are very likely without relentless global action to combat this disease. And as the 1 million death toll, the global community has reached a 1 million death toll in this pandemic and has surged around the planet. The WHO, that's the World Health Organization, said the prospect of another million deaths was not unimaginable if countries and the individuals like myself and yourself do not come together to tackle the crisis. 1 million is a very terrible number, and we need to reflect on that before we start considering another million. That's the second million. That's according to World Health Organization's Emergencies Director Michael Ryan, who told a virtual news conference when asked if it was unthinkable that 2 million people could die in the pandemic. But he said, "Are we prepared collectively to do what it takes to avoid that number? If we don't take those actions, yes, we will be looking at that number, and sadly much higher. Unless we do it all, the numbers you speak about are not only imaginable, but unfortunately, very sadly, very likely." Those are the words according to Michael. Welcome to another edition of the program. It is the first edition for the last week in the month of September 2020. This is Abia State COVID-19 update. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19 in Abia State, as well as the state governor's efforts in combating, of course, ensuring that the state is safe. And I'm talking about the governor of the state, Dr. Okezie Ikpeazu. This program is running simultaneously every weekday, Mondays through Fridays, on several radio stations: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Now, the global deaths for coronavirus has passed 1 million, with 1,2,461 recorded this morning as at 8 a.m. when I captured the figures. And the total cases globally stands at 33,311,425, with the recovered at 24,639,264. India's confirmed coronavirus tally reached 6 million cases. That was this morning, keeping the country second to the United States in the number of reported cases since the pandemic began. Boris Johnson of UK, that's the UK Prime Minister, is facing a massive parliamentary revolt over the way he's imposing COVID-19 restrictions on the British people without first consulting MPs, amid new signs that confidence in his leadership is collapsing in the Conservative Party and across the country. Well, let's bring it back home. Nigeria recorded 2 new deaths from coronavirus in the last 24 hours. A total of 1,108 deaths have so far been recorded in Nigeria. Nigeria also confirmed 126 new cases of COVID-19, with the recovery inching towards the 50,000 mark. Presently, it is at 49,794. These numbers are according to the Nigeria Center for Disease Control dashboard captured this morning. And also, presently the country's total infections is at 58,329. A look at the new figures for the virus shows that the Federal Capital Territory had the highest number of infected persons with 30, followed by Lagos with 24. Rivers State recorded 23, Ogun State reported 13, Katsina State reported 9, Plateau State reported 9, Ondo State reported 6, neighboring Imo State reported 2, Bauchi and Edo State with 1 each. And although the number of fresh cases has been on a decline in recent months in Nigeria, the coronavirus has claimed 1,108 lives so far in Nigeria. As the country battles to contain the pandemic and reopen an economy, it's imposed a lockdown on the onset of the disease. The fight against COVID-19 appears to be yielding results. 49,794 people who contracted this virus have been fully discharged, of course, treated and discharged. Well, there are adjustments to the protocols put in place by Abia State government. We will let you know those adjustments. We will connect the secretary to the Abia State government and the chairman of the Interministerial Committee on the Control of COVID-19 in Abia State later on this morning. There are some of those directives that you should know, so that you will be well briefed about the latest concerning COVID-19 in Abia State. There are some things you should know, especially the transporters and of course everyone, just everyone. All right, we have joining us this morning Barrister Chris Ezim, the chairman of the Interministerial Committee on COVID-19 in Abia State, and also he is the secretary to the state government. Barrister, good morning to you.
Sam, how are you? Good morning.
Good morning to you. Welcome to Abia State COVID-19 update. It's a very important day in Abia State. Schools are resuming. Primary and secondary schools in the state are resuming. I don't know if you've been to some of the schools for monitoring and compliance level.
Yeah, the Ministry of Education is doing that.
Oh, interesting.
Already, yes.
Oh, all right. Barrister, some protocols were reviewed last week.
Yes.
I saw the press release. Can you run us through the protocols, the churches, the markets, the schools?
Yeah, I will go straight to that.
Yes,
what we are trying to do basically is to remind our people that this journey and the race is not over, so that they don't take anything for granted. And basically, we try to remind them once again of our protocols. As it affects schools, we said clearly that the schools will be reopening today, primary and secondary schools, while proper guidelines are being put in place for the resumption of tertiary institutions. But for these primary and secondary schools, we will make sure that all protocols are observed, just as we did when we reopened the school for exit classes. And we are saying for our religious activities, the protocols still remain the same. But what we've done again is to allow activities. You
said the religious activity
remains the same as in the number of worship.
Okay.
Yes, it remains the same thing, because we recognize the fact that it's a veritable area where we can lose it, so we don't want to drop the guidelines down too much. But what we've done again to ease, because I've had some complaints and some requests from churches, because in respect of burials, that they have to run burials in segments, but have 2-3 burials in a day, because we were doing only first and third week. So what I've done is to relax the measure down a little by allowing burials to go on every week. Every week, but still limited to Thursdays, Fridays, and
Saturdays only.
Yeah, but every week. Now, but you will still go through the process of applying through your local government chairman, and then sign the undertakings, which limits you to number, and in terms of the protocol, other protocols, you still have to sign that. But you can now bury every week of the month, Thursdays, Fridays, and Saturdays.
Oh, great.
Yes. Great. Our market standards and protocols is still the same, Mondays to Saturdays, 7 to 5 p.m. And the same applies with respect to transportation. Okay. The numbers are still limited. We do not want to risk it. You can see what is happening in the UK. The spike has gone up, and then they are going back to lockdown and whatever again.
Yeah, the same thing with Israel.
Israel. So we don't want to lose it. Yes, we are doing very well, but still we still have to be cautious. And our community testing within the LGAs are still in progress.
Oh, great.
And then furthermore, we have, you remember, 2 weeks back, we commissioned our molecular labs in Abia, the IDH center. And then we're testing have started going on in those places. So we're equally asking Abians to feel free to work, apart from the community testing, walk into Amachara, walk into IDH or the other molecular lab in the general hospital. You can run your test and know your status. And then our medical protocol teams are still available to nurse whoever tests positive back to good health. Early discovery is the answer. Precaution is the better model to take. So we still encourage and urge all Abians to continue to wear their face masks and use their sanitizers and wash their hands at every available opportunity. Okay,
Barrister, let's look at the markets also in the States.
Yes,
we have we had some protocols laid down initially for market operation in Abia State. Do we have any review on that?
No, we don't have any review. The market committees are still there.
All right.
And to ensure that those laid down protocols are maintained. Remember, the market is a very wide place, and then you won't be too fast to relax any protocol there. And what we've done in our sensitization, we have our sensitization committee in all the LGS. We equally have told them that it is good for all you going into the market. Our sensitization and advocacy team are saying it clearly. If I come to buy from you and I'm not on my face mask, it is your duty as a market woman who is selling or buying to say, wear your face mask. If you selling to me is not wearing, it's my duty as a buyer to say, put on your face mask. Just like if I enter in the transport vehicle, I will insist the driver wear your face mask. You understand? So the campaign is that of everybody. The campaign is everybody's duty. We have to take our destinies in our hands. We have an ambassador of COVID-19. I'm an ambassador of COVID-19. It's not just that of the ministerial committee or that of the committee for the market. It's everybody's duty now. Carry the campaign everywhere you go and be a vanguard of COVID-19 protocol.
Interesting. Let's look at the transportation sector now in Abia State as far as COVID-19 is concerned. We also had some protocols laid down initially. Are they still in place?
They are in place. They're in place.
That's the...
We are not reviewing anything and then pass.
Okay.
Keke is 2. Remains 2. We are not reviewing that down at all.
Okay.
Yeah.
The shuttle bus known as Okebeke.
4.
And the buses?
9.
All right, interesting. Thank you very much, Barrister. But we have issues with compliance in Abia State. Some persons are being arrested also, but we have issues with compliance, especially as far as tricycle operators are concerned. Despite the increment in the prices of transporting a drop for keke, which has gone up to 100 naira, they still go and disobey those protocols, collecting the same 100 naira. We have situations where the keke will still carry more than 2 persons and still collect 100 naira from Abians.
Well, let me tell you, it's very simple. Why should I enter if you are carrying more than 2 persons? Do you understand? If I stop you and you have 2 persons already there, I don't have to enter that keke. You can't force me into it. Look, Abians themselves are supposed to be the first level of enforcement.
Interesting.
You get my point?
Yeah, yes, I'm getting your point.
The keke stops and will not enter if he's already carrying 2 people. So if you and I start doing that effectively, then the keke man cannot do it, has no option.
All right.
to do the needful.
All right, Barrister.
Thank you.
Chris Ezem, I really want to appreciate your time on the program. We will get back to you as event unfolds concerning coronavirus in Abia State. Thank you very much for speaking to us this morning on Abia State COVID-19 update.
Thank you. God bless you.
All right, that's Barrister Chris Ezem, the chairman of the Interministerial Committee on the Control of COVID-19, and also the chairman of the committee, and also the SSG, that's the secretary to the state government. I will throw the lines open this morning for you to make your contributions. Some persons have observations they want to share with us. I'm going to throw the lines open. 0808 182 6949. 0811-605-2949. You can also drop messages on 0906-510-8289. It is very important that we note that no one is safe until everyone is safe, and we have schools reopening today. They've reopened already, so in the coming editions of this program, we will be turning our attention, our beam light on the schools in Abia State. Let's see who is on the line. Hello, good morning to you.
Good morning.
Yes.
Please, I want to know about
what's your name? What's your name, please?
About this tertiary institution. When are they opening?
Yes. What's your name initially? I'm going to answer your question, Emmanuel. All right, go on.
Yes. Please, I want to know about this tertiary institution. When are they opening? You still more than those primary and secondaries. You still more than them. Our time are going. Most of us are final year. I have not finished our listing. I have not really did our exams. So when are we resuming? I have our place. That's my question.
All right. That will be answered before the end of the program. Hello, good morning to you.
Hello, good morning.
Yes, you're welcome. All right, Ikechukwu.
I want to ask, the observation now. This protocol observation. It's like it's not a security company. If there is somebody who knows face mask, that can be smoking in public, pouring air, and people can perceive it. And get the virus through the smoking, churches are giving observation, but the security company allowed to free. It's not good. All state government should give directives to all security staff.
Yes.
Want to smoke, go into your house and smoke, not to come to public and smoke. That's one thing.
All right.
Or can't they get the virus through smoking? Okay now.
All right. I didn't get your question anyway. But Emmanuel, I decided to go get that press release by the government last week. The ESCO met, and of course some decisions were taken, especially concerning the resumption of schools that led to the resuming of primary and secondary schools. Paragraph 5 says ESCO approved the resumption of tertiary institutions in the state based on the timetable and protocols submitted to the state government, as well as will be announced by the management of each school, which means you should be waiting for the management of your school for the resumption. I'm talking about the tertiary institutions now in the state, so that will be determined by the management of each school. Let's see, we take this and we'll wrap up the program this morning. Hello, good morning. You have 30 seconds.
I'm Uzo Akrawolu. I'm coming from Selangor South.
Okay.
We were told that schools will be communicated before reopening. What is it that is added? My own particular school, the clinic was locked. The community did it themselves. Now, what is school doing about providing these pupils with masks and all the rest of them to make sure that these children are safe or resumption of school?
All right, that question will be directed to the committee. That's the Interministerial Committee on COVID-19. I do appreciate your observation also. Thank you very much. All right, that's how far we can go this morning. Many thanks to the stations, the partner radio stations for this program: Abia State COVID-19 Update, BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. The program returns tomorrow. It is very important that we keep staying safe. very, very important that we keep staying safe, because no one is safe until everyone is safe. Thank you very much. My name is Michael Oni.
Today's Abia COVID-19 update.
Abia COVID-19 update.